Hello guys, so today we are going to cover the topic of salivary glands. So salivary glands are the exocrine glands which are found in the oral cavity, and the function of this is to secrete the saliva. So there are three pairs of salivary gland, that is the parotid gland, the submandibular gland and the sublingual gland. The parotid gland is the largest gland out of all three. So in addition, there are numerous small glands in the tongue, the palate, the cheeks and the lips. So classification of the salivary gland on the basis of the size, and it is based on the type of secretory cell. Starting with the classification which is based on the size, it consists of the major salivary gland and the minor salivary gland. So major salivary gland, it is bilaterally paired extraoral gland with the duct system, and the gland through which the gland secretion reaches the mouth. So the major salivary glands are the parotid gland, the submandibular gland and the sublingual gland. So this is the parotid duct, this is the parotid gland, the largest gland. This is your submandibular gland and this is your sublingual gland. Coming on to the minor salivary gland, so these are the secretory cells which are scattered throughout the mucosa and submucosa of the oral cavity, with the short ducts opening directly into the mucosal surfaces. So the minor salivary glands are the serous glands of the von Ebner, the anterior lingual glands, the lingual, buccal, labial and palatal glands, the glossopalatine and the retromolar glands. Second classification is on the basis of the type of secretory cells. So parotid is completely serous, mixed salivary glands is your submandibular, and completely mucous is your minor salivary glands. So this is the development of the salivary glands. So there are basically 6 stages in which there is the development of salivary gland takes place. So in the first stage, the bud formation take place. In the second stage, the formation and the growth of epithelial cord. The bud formation is further takes place to form the epithelial cord. In the third stage, the initiation of the branching in the terminal parts of the epithelial cord, and in the fourth stage there is a branching of epithelial cord and the lobule formation. The fifth stage comprises of the canalization, and the sixth stage is the cytodifferentiation. We will discuss these development of salivary glands one by one. Stage number 1, which is the bud formation. In this, the proliferation of the epithelium occurs into the ectomesenchyme. So basically there is a bud formation, and then there is the separation of the basal lamina. So the interaction of the epithelium with the underlying condensate mesenchyma is associated with the salivary gland, which provide the optimum environment for the gland formation. So this is the first stage in which there is the bud formation takes place. So in this, the proliferation of the oral epithelium occurs into the mesenchyme, which leads to the bud formation, and later on it gets separated from the basal lamina. So it is a separation of the basal lamina. Coming on to the second stage, that is the formation and the growth of the epithelial cords. So in this, there is the proliferation of the epithelial bud. There is a proliferation of the epithelial bud into the long subepithelial cords. And then the mesenchyma around the developing granular epithelium also proliferates. And the basal lamina is believed to play an important role in influencing the morphogenesis and the differentiation of the salivary gland. So, in the second stage, there is a proliferation of the epithelial bud into a long subepithelial cord, and the mesenchyma around this also proliferates. Coming on to the third stage, that is the initiation of the branching in the terminal parts of the epithelial cords. So in the third stage, there is the branching of the cords into the bulbs. So epithelial cord proliferate and its end branches into the bulb. So coming on to the stage 4. So in this, the branching of the epithelial cord occurs and a lobule formation is seen. So in this, the branching of the epithelial cord and the lobule formation, in this, the terminal end branch extensively forming the numerous bulbs, that is the cleft formation, and the connective tissue component below the epithelial cord forms the capsule and surrounds the entire gland. Hypothesis: the epithelial mesenchymal interactions. In this, the fibroblast growth factor family and their receptor transforming growth factor B. So differential contraction of the actin filament at the basal and the apical ends of the epithelial cells. Coming on to the fifth stage, that is the canalization. So in this, the canalization of the cords takes place. So there is a lumen formation at the distal end of the first there is a lumen formation at the distal end, then the lumen formation taken place into the proximal end, and at the last the lumen formation takes place into the central part. So in the middle, the apoptosis process is seen. The apoptosis is the programmed cell death. So apoptosis of centrally located cell. You can see the apoptosis in the center of the cord, or you can say the center of the canal. So in this, the secretion of the fluid by the ductal cells, which increases the hydrostatic pressure within to form a canal. So in the canalization, a canal formation takes place. First, the canal formation takes place at the distal end, then the canal formation takes place at the proximal end, and at the last it will take place at the center. An apoptosis of the centrally located cell is also seen in this stage. Coming on to the stage 6, that is the cytodifferentiation. In this, the epithelium consists of the two layers, that is the inner layer and the outer cell layer. So the inner cell, it differentiates into the mucus or the serous cell, and other cell, or you can say the outer cell, it differentiates into the myoepithelial cell. So the inner cells differentiate into the mucus or the serous cells, and the outer cells differentiate into the myoepithelial cells. So in this, the portion of the epithelial bud close to the oral cavity forms the main excretory duct, and the distal portion forms the secretory and the piece. So there is a lobule formation and the connective tissue septum. So in this, the parenchyma increases in size, which diminishes the connective tissue and remains a thin layer. So in this, the thicker part, this is the thicker part of the connective tissue. It continues, and the capsule with the capsule and supplying the gland with the nerves and the blood vessels. So this is the thicker portion of the connective tissue, which continues with the capsule and supplying the glands and the nerves and the blood vessels. And here you can see the nerves and the blood vessels which supplying the gland, which supplies the gland. So parotid, it is seen in the 4 to 6 weeks of the intrauterine life. Submandibular seen at the 6th week of the intrauterine life. Sublingual and the minor salivary gland seen at the 8th week of the intrauterine life. So maturity of the secretory end piece is during the last 2 months of the gestation. Secretory components of the gland continues to grow postnatally, while as the ductal connective tissue components and the vascular component, it decreases up to 2 years of age. This is very important. So this is the stages of the development of the salivary gland. At the first stage, what you can see is the proliferation of the epithelial bud. In this, the proliferation of the oral epithelium occurs into the mesenchyme in the form of bud. And in the second stage, there is a proliferation of the bud stage into the long epithelial cord, and the mesenchyma around the developing granular epithelium also get proliferates. And in the third stage, you can see the branching of the cords into the bulbs. In the stage 4, you can see the branching of the epithelial cords and the lobule formation. In the stage 5, you can see the canalization of the cords. And in the 6th stage, you can see the cytodifferentiation. In this, the cytodifferentiation, in this the epithelium consists of the 2 layers of cells, that is the inner cell which differentiate into the mucous and the serous cells, and the outer cells that differentiate into the myoepithelial cells. So coming on to the very important part, that is the anatomy of the salivary gland. Starting with the parotid gland, it is the largest salivary gland, and it constitutes of 60 to 65% of the total saliva. It is pyramid in shape and weighs between 14 to 28 grams. So it has a superficial part. This is the superficial part. It has a deep part. The superficial part is located in front of the ear, while the deep part, it is located behind the ramus of the mandible. And the parotid gland, it is associated with the facial nerve. So this is the ramus of the mandible. This is the external acoustic meatus. This is your sternocleidomastoid muscle. So this is the superficial part which is located in front of the ear, and this is the deeper part which is located behind the ramus of the mandible. Coming on to the capsule of the parotid gland. So there is an investing layer of the deep cervical fascia which form the capsule of the gland. So the fascia, it splits into two parts. Number one, it splits into the angle of the mandible and the mastoid process. Okay, so the superficial lamina is thick. This one, the superficial lamina, it is thick, and it is attached above to the zygomatic arch. While your deep lamina, this is your deep lamina, this is the superficial lamina, which is thick and is attached above to the zygomatic arch, and this is your deep lamina, it is thin and it is attached to the styloid process and the angle and the border of ramus of the mandible and the tympanic plate. I repeat, so it is divided into two parts, the superficial layer and the deep layer. The superficial layer, the superficial lamina, it is thick and it is attached above to the zygomatic arch, while the deep lamina, it is thin and it is attached to the styloid process, the angle and the posterior border of the ramus of the mandible and the tympanic plate. So the portion of the deep lamina is extend between the styloid process and the mandible and is thickened to form the stylomandibular ligament, which separates the parotid gland from the submandibular gland. So coming on to the external features, so it resembles a three-sided pyramid. So the apex, this is the apex which directed downwards. This is the apex which directed downwards. So this is the apex, and it consists of the four surfaces, that is the superior, the superficial, the anteromedial and the posteromedial. So this is the deep part which is located behind the ramus of the mandible. This is the superficial part which is located in front of the ear. So the apex directed downwards, so it has the four surfaces, the superior surfaces and the base of the pyramid. This is the base of the pyramid. This is the superficial surface. This is your anteromedial surface, and this one is your posteromedial surface. So the surfaces are separated by the three borders, that is the anterior border, the posterior and the medial border. Here is your medial border, which divide the gland into your anteromedial surface and the posteromedial surface. Here is your anterior border and here is your posterior border. So this is the base, this is the superficial surface, this is your anterior medial surface, this is your posterior medial surface, and this is your medial border, the anterior border and the posterior border. Coming on to the relation, the apex, this is the apex, it overlaps the posterior belly of the digastric and adjoining part of the carotid triangle. So the cervical branch of the facial nerve and the two division of the retromandibular vein emerges through it. So coming on to the surfaces, number one is the posterior surface. So the superior surface or the base form the upper end of the gland, which is a small and concave, and it is related to the cartilaginous part of the external acoustic meatus. This one, the external acoustic meatus, and the posterior surface of TMJ. The superficial temporal vessels. The superficial temporal vessel and the auriculotemporal nerve. So the superior surface or the base, it is formed at the upper end of the gland, which is small and concave, and it is related to the cartilaginous part of the external acoustic meatus and the posterior surface of TMJ, the superficial temporal vessel and the auriculotemporal nerve. The superficial surface, it is the largest surface of the four surfaces, and it is covered with the skin, the superficial fascia, the parotid fascia, and a few deep parotid lymph nodes. Coming on to the anteromedial surface. So the anteromedial surface is grooved by the posterior border of the ramus of the mandible. So it has a masseter surface. This is related to the masseter, the lateral surface of the temporomandibular joint, the posterior border of the ramus of the mandible, the medial pterygoid, and the emerging branches of the facial nerve. So it consists the anteromedial surface is consist of the 5 surfaces, that is, number 1 is your masseter muscle, the masseter, the lateral surface of TMJ, the posterior border of the ramus of the mandible, the medial pterygoid, and the branches emerging of the facial nerve. Coming on to the posteromedial surface. The posteromedial surface is molded to the mastoid. The posteromedial surface is molded to the mastoid and the styloid process. This is the styloid process, and this is related to the mastoid. This is the mastoid with the sternocleidomastoid. This is the sternocleidomastoid and the posterior belly of digastric. And the styloid process, and this is the styloid process. The structure is attached to it. The external carotid artery enters the gland through this surface, and the internal carotid artery lies deep to the styloid process. So the posteromedial surface, it is related to your mastoid process, sternocleidomastoid, the posterior belly of digastric, and the styloid process with the structure attached to it are the external carotid artery which enters the gland and the internal carotid artery which lies deep to the styloid process. Coming on to the relations of the anterior border. This is the anterior border, this is the posterior border, this is the anterior border. So it consists of the zygomatic nerve, the transverse facial artery, the upper buccal nerve, the accessory parotid gland, the parotid duct, the lower buccal nerve, and the marginal mandibular nerve. Coming on to the posterior border, that separate the superficial surface from the posteromedial surface, and it overlaps the sternocleidomastoid. This one, the sternocleidomastoid in the posterior surface. So the medial edge or the border separates the anteromedial surface. See, this is the medial border which separates the anteromedial surface and the posteromedial surface. So it is related to the lateral wall of the pharynx. This one. Coming on to the structures within the parotid gland. So the artery from the medial side to the lateral side, from the medial side to the lateral side. So in this, the external carotid artery, it enters the gland through the posteromedial surface, and the maxillary artery, it leaves the gland through its anteromedial surface. So the superficial temporal artery, it gives off the transverse facial arteries which emerges at the anterior part of the superior surface, and the posterior auricular artery may arise within the gland. I repeat, your external carotid artery, it enters the gland through the posteromedial surface, while your maxillary artery, it leaves the gland through the anteromedial surface. The superficial temporal artery gives the transverse facial artery and emerges at the anterior part of the superior surface, while the posterior auricular artery may rise within the gland. So this is the arteries. Coming on to the veins. So the retromolar vein, it is formed within the gland with the union of your superficial temporal vein and the maxillary vein. This is the maxillary vein, this is the superficial temporal vein. So the lower part get divided into two parts. The anterior part, this is your anterior division, and this is your posterior division. So your retromolar vein, it is formed within the gland by the union of your maxillary vein and the superficial temporal vein, and it is divided into into the apex. It is divided into the two parts, that is two division, that is the anterior division and the anterior division and the posterior division. So coming on to the facial nerve. The facial nerve, it enters the gland through the upper part of the posteromedial surface, and it divides into the terminal branches within the gland, and the branches leave the gland through the anteromedial surface. So the facial artery, it enters the gland through the upper part of the posteromedial surface. Here posteromedial surface is entering side, and it divides into the terminal branches, and the terminal branches leave the gland through anteromedial surface. See, the facial nerve enters through posteromedial surface, then it get divided into the terminal branches, and the terminal branches leave the gland through anteromedial surface. So the facial nerve lies in relation to the isthmus. This is the isthmus of the gland, which separates into superficial part. This is the superficial part, and this is the deep part of the gland. So the superficial part, it consists of the temporofacial nerve, which divides into this temporal nerve and the zygomatic nerve, the temporal branches and the zygomatic branches, while the deep part, it divides into, you can say, the cervicofacial, or the deep part, it divides into your upper buccal branch, the marginal branch and the cervical branch. So I repeat, the facial nerve, it enters through into the gland to the upper part of the posteromedial surface, and after this it divides into the terminal branches, and all the terminal branches, it leaves the gland through the anteromedial surface. So the facial nerves, it lies to the isthmus, and it separates into the superficial part and the deep part. The superficial part, it consists of the temporofacial, the deep part consists of the cervicofacial. The temporofacial, it divides into the temporal branch and the zygomatic branch, while the cervicofacial, it divides into the buccal, the martial mandibular and the cervical branch. Coming on to the pes faciovenous plane. So it is a gland It is composed of the large superficial part and a small deep part, and the two are connected by an isthmus. This is the isthmus around which the facial nerve, the seventh nerve, which is the facial nerves, get divides. Important for your exam point of view. Coming on to the Stenson's duct. So the duct in the parotid gland, it's called as the Stenson duct. So it runs, the Stenson duct, it runs forward across the masseter muscle and inwards at the anterior border of the masseter, and opens at the papilla in the oral cavity, just opposite to the second maxillary molar crown. Side is 3 cm or 5 cm into 3 cm. So there is a small portion of the parotid forms the accessory parotid gland, with the Stenson's duct just anterior to the superficial portion of the gland. So the Stenson duct, it runs forward the masseter muscle and turns inward at the anterior border of the masseter and opens at the papilla in the oral cavity just opposite to the second maxillary molar. And a small portion of accessory parotid gland is associated with this Stenson's duct. So superiorly, accessory parotid gland, upper buccal branch of the facial nerve, the transverse facial vessel. Inferiorly, the lower buccal branch of the facial nerve at the anterior border of the ramus, it turns medially and pierces. And it pierces the buccal pad of the fat, the buccopharyngeal fascia, and the buccinator obliquely. Because of the oblique course of the duct through the buccinator, the inflation of the duct is prevented during blowing. So coming on to the nerve supply. The nerve supply is parasympathetic, that is secretomotor, the auriculotemporal nerve, which produces watery secretion. The sympathetic are the vasomotor and the mucus-rich sticky secretions. It derived from the plexus around the external carotid artery. And the sensory are the great auricular and the auriculotemporal nerve. Now, coming on to the parasympathetic secretomotor pathway. So the parasympathetic innervation to the parotid gland, it has a complex path. It begins with the glossopharyngeal, that is the 9th cranial nerve, and this nerve synapses with the otic ganglion. The otic ganglion, it is a collection of neuronal cell bodies, and then the auriculotemporal nerve then carries the parasympathetic fibers from the otic ganglion to the parotid gland. So the parasympathetic stimulation causes increase in the saliva production. So in this, the parasympathetic innervation, it begins with the glossopharyngeal nerve and it enters to the tympanic branch and it forms the tympanic plexus and further lesser petrosal vein, and this nerve synapses takes place in the otic ganglion, and otic ganglion, it is a collection of the neuronal cell bodies, and after this it reaches to the auriculotemporal nerve, and the auriculotemporal nerve then carries the parasympathetic fibers from the otic ganglion to the parotid gland. Coming on to the vascular supply and the lymphatic drainage. So arterial supply is through the external carotid artery, venous drainage is external jugular vein, and the lymphatic drainage is from the upper deep cervical lymph nodes. Now coming on to the second salivary gland, that is the submandibular salivary gland. So this salivary gland, it is situated at the anterior part of the digastric triangle. So the gland is about a size of a walnut, and it is a J-shaped, which is divided into a larger part which is superficial, and a deep part, it is a smaller part. So basically the submandibular gland, it is the size of a walnut, and it is situated in the anterior part of the digastric triangle, and it is a J-shaped gland, comprises of a superficial part, that is the large part, and the deep part, it is a small part. Coming on to the superficial part, this part of the gland fill the digastric triangle. It extends upwards deep to the mandible up to the mylohyoid line. So it has inferior, lateral and medial surfaces. So in this, the gland is partially enclosed between the layers of the deep cervical fascia. The superficial layer of the fascia covers the inferior surface of the gland, and it is attached to the base of the mandible. This is the superficial layer, and the layer of the fascia, it covers the inferior surface of the gland, and it is attached to the base of the mandible, while the deep layer covers the medial surfaces of the gland, and it is attached to the mylohyoid line of the mandible. So the gland is partially enclosed into the two layer, that is the deep layer and the cervical and the superficial layer. The superficial layer the gland is partially enclosed between the two layers of the deep cervical fascia, and this is the superficial layer, this is the deep layer. The superficial layer, it covers the inferior surfaces of the glands and get attached to the base of the mandible, while the deep layer, it covers the medial surface of the gland, and it is attached to the mylohyoid line of the mandible. Coming on to the relation, the inferior surfaces is covered by the skin, the platysma, the cervical branch of the facial nerve, the deep fascia, the facial vein, this is the facial vein, and the submandibular lymph nodes. So the lateral surface, it is related to the submandibular fossa of the mandible, insertion of the medial pterygoid, and the facial artery. So the medial surface is related to mylohyoid, hyoglossus and the styloglossus muscles from before backward. Inferiorly, it overlaps stylohyoid and posterior belly of digastric. So this is the styloglossus muscle. Coming on to the deep part, which is the part, it is small in size. This is small in size. It lies deep to the mylohyoid and superficial to hyoglossus and styloglossus. And posteriorly it continues with the superficial part rounded posterior border of the mylohyoid. anteriorly it extend up to the posterior end of the posterior end of the sublingual gland. So the deep part, it is a small in size. It lies deep to the mylohyoid and the superficial to the hyoglossus and the styloglossus, and posteriorly it is continuous with the superficial part round the posterior surface border of the mylohyoid, and anteriorly it extends up to the posterior end of the sublingual gland. Coming on to submandibular duct, it is a thin walled, it is about 5 cm long, and it emerges at the anterior end of the deep part of the gland. It runs forward on the hyoglossus between the lingual and the hypoglossal nerves. At the anterior border of the hyoglossus, the duct is crossed by the lingual nerve. So it opens on the floor of the mouth on the summit of the sublingual papilla at the side of the frenulum of the tongue. So this is the Watson duct. This is the Wharton's duct. The Wharton's duct, it runs forward and opens into the mouth beneath the tongue and lateral to the lingual frenum. So duct which is associated with the parotid was Stenson's duct, and the duct which is associated with the submandibular is the Wharton's duct. Coming on to the blood supply, facial and the lingual arteries, nerve supply, the parasympathetic supply by the facial nerve which reaching the gland through the lingual nerve and the submandibular ganglion, while the parasympathetic supply through the postganglionic fibers from the plexus on the facial artery, and the lymphatic drainage through the submandibular lymph nodes and the deep cervical lymph nodes. So these are the glands, where they are situated, their duct opening and the secretions. Coming on to the parotid, so it has the two parts, as I've already told you. It has a superficial part and a deep part, and the superficial part, it located in front of the ear, while the deep part, it lies behind the ramus of the mandible. So it is the largest gland of all. Submandibular gland, it is of J shape, and it is divided into large superficial part and small deep part by the mylohyoid muscles. So duct is the Stenson's duct. After piercing the buccinator, it opens up to the vestibule of the mouth opposite the crown of the second molar, while the Wharton's duct, it opens on the floor of the mouth on the summit of the sublingual papilla at the side of the frenulum of the tongue. So secretion is, the parotid gland is purely serous, while the submandibular gland, it is mixed gland, predominantly serous. Coming on to the sublingual gland, it is the smallest of all the three salivary glands. It is situated above the mylohyoid and below the mucosa of the floor of the mouth. The Bartholin's duct, 10 to 15 duct emerges from this gland. So most of them open directly into the floor of the mouth on the summit of the sublingual fold. A few of them join the submandibular duct. So it is also mixed. It also has a mixed secretion, but predominantly mucus in nature. So these are the arterial and the venous supply. Coming on to the parotid, arterial supply and the venous supply, the external carotid artery and the external jugular vein, while the submandibular through the facial artery, veins drain into the common facial or the lingual vein, and the sublingual, in this the sublingual and the submental arteries. So lymphatic drainage, the parotid lymph drains first into the parotid nodes and from there to the upper cervical, to the upper deep cervical nodes, while the submandibular gland, in this the lymph drains into the submandibular lymph node, and in the sublingual gland the lymph drains into the submental lymph nodes. Coming on to the nerve supply, the parasympathetic, the preganglionic fibers begin in the inferior salivary nucleus and then passes through the ninth nerve and the lesser petrosal nerve and relay in the otic ganglion. The postganglionic fiber reach the parotid gland through the auriculotemporal nerve. This I have already told you about the parasympathetic, that the parasympathetic innervation to the parotid gland has the complex path. It begins from the ninth cranial nerve, that is the glossopharyngeal nerve, and the nerve synapses with the otic ganglion. Otic ganglion, it is a collection of the neuronal cell bodies, and then the auriculotemporal nerve then carries the parasympathetic fibers from the otic ganglion to the parotid gland. Coming on to the sensory part of the parotid gland, the sensory nerve supply is through the auriculotemporal nerve. The parotid fascia is supplied by the sensory fiber of the greater auricular nerve. Coming on to the submandibular gland, the parasympathetic, in this the preganglionic secretomotor fibers begins in the superior salivary nucleus, and then it passes through the facial nerve, chorda tympani, the lingual nerve to reach the submandibular ganglion. While the postganglionic fibers, it emerges from the ganglion and enter into the submandibular gland. And in the sublingual gland, the nerve supply is similar to the submandibular gland. So, purely mucous are the glossopalatine, the palatine, and the anterior lingual glands. Parotid is purely serous, and the mixed salivary glands are submandibular but mainly predominantly serous, sublingual but predominantly mucous. Labial and the buccal glands, posterior lingual glands. Coming on to the third and the last gland, salivary gland, that is the sublingual gland. So it is the smallest major salivary gland with a weight of 2 gram, and it constitutes 2.5% of the total saliva. So it is located at the anterior of the floor of the mouth, just between the mucosa and the mylohyoid muscle. So it opens into the oral cavity through a series of small ducts, that is the duct of Rivinus, opening along the sublingual fold, and opens through the large duct, that is the Bartholin's duct, that opens with the submandibular duct at the sublingual carbuncle. With the duct at the sublingual carbuncle. So the blood supply, it is supplied by the sublingual and the submental arteries, the lymphatic drainage through the submental lymph nodes, and the nerve supply, the parasympathetic supply, is through the facial nerve, which reaching the gland through the lingual nerve and the submandibular ganglion, while the sympathetic supply, it is through the postganglionic fibers from the plexus on the facial artery. So number, it ranges between 600 to 1000. It exists as the aggregates of the secretory tissue present in the submucosa throughout most of the oral cavity. It is not seen in the gingiva, very important, and anterior part of the hard palate. So it is rich in mucin, it has antibacterial proteins and the secretory immunoglobulins. So it continues slow secreting glands, thus have an important role in protecting and moistening the oral mucosa, especially when the major salivary glands are mostly inactive. Von Ebner's lingual serous gland. It is located in the tongue and open into the troughs, surrounded the circumvallate papilla on the dorsum of the tongue and the follate papilla on the side of the tongue. So it secretes digestive enzymes and proteins that are thought to play a role in the taste process. So fluid of their secretion cleanse the trough and prepare the taste receptors for a new stimulus. So this is all about the salivary gland. It is a very important topic. Please go through it once. Thank you.